everyone. I'm Dr. Eric Coomes, one of the co-investigators for the Control COVID trial of chemoprophylaxis to control outbreaks of COVID-19 in long-term care homes. Today, we're going to speak about the medication we're using in this trial, Favipiravir. Favipiravir is an antiviral medication which acts to inhibit the RNA polymerase of various viruses, meaning that it acts to block the replication of the virus's genetic material. In the laboratory, Favipiravir has been identified to have activity against a number of different viruses, including influenza, the virus causing the flu, other emerging infections such as Ebola, and other agents of viral hemorrhagic fever, and most recently, SARS-CoV-2, the virus which causes the new pandemic infection, COVID-19. Favipiravir has been used in multiple circumstances clinically. It was studied for influenza and subsequently approved in Japan for novel influenza strains unresponsive to standard antiviral therapies. In addition, Favipiravir has been studied for Ebola, another emerging infectious diseases. It was used for both treatment as well as prophylaxis for Ebola, and in the studies of Favipiravir for Ebola, it was generally well tolerated and had promising signals of benefit for post-exposure prophylaxis. So what about the use of Favipiravir for COVID-19? What evidence do we have so far? Well, first off, as we mentioned, Favipiravir has been identified to have activity in the laboratory against SARS-CoV-2. As a result of this in vitro activity, multiple clinical trials are ongoing worldwide to investigate the role of Favipiravir as a treatment for COVID-19. There are more than 10 registered clinical trials on clinicaltrials.gov. Further, the early experience so far with Favipiravir for COVID-19 is promising. In the trial by Kai et al., where Favipiravir was compared to lopinavir and ritonavir, a medication typically used for HIV, Favipiravir was identified to be associated with a shorter duration of viral shedding, a higher proportion of radiographic improvement, and significantly fewer side effects as compared to lopinavir and ritonavir. Further, in the study by Chen et al., in patients who had moderately severe COVID-19, there was a greater rate of clinical recovery. Now, is Favipiravir a safe medication? The answer is yes. Favipiravir is generally considered a safe drug. There are more than 40 clinical studies which have been conducted with Favipiravir to date, in which no serious related adverse events were identified. This medication is generally well tolerated in adults and elderly patients in the studies of influenza. Now, when we look a little bit closer at the side effects of Favipiravir, we can see that there were no serious side effects and no very common side effects. In the side effects that do occur, they typically are gastrointestinal side effects, diarrhea or nausea, which can generally be controlled, as well as elevations of certain blood markers without damage to the organs and which resolve upon discontinuation of the medication. As a result of the activity of Favipiravir in the laboratory, the early promising evidence in clinical trials to date, and the favorable safety profile of Favipiravir, we are using Favipiravir as the drug for chemoprophylaxis in our trial. Participants of the trial will be randomized to Favipiravir or placebo as chemoprophylaxis for 25 days. Those participants who are diagnosed with COVID-19 at the beginning of the trial will receive a 14-day course of treatment as per the randomization allocation. Now, Favipiravir comes as 200 milligram tablets that are yellow in color. This medication can be taken orally and can be taken with or without food. In the trial, the dosage of Favipiravir for prophylaxis is on day 1, 1,600 milligrams orally twice, and from day 2 to 25, 800 milligrams orally twice daily. For those participants receiving Favipiravir for treatment, they will receive 2,000 milligrams orally twice on day 1, and 1,000 milligrams orally twice daily from day 2 to 14. Now, while Favipiravir is generally considered a safe medication, to increase the safety of participants in our trial, we have a few additional exclusion criteria that would be contraindications for patients to receive the drug. Firstly, patients who are pregnant may not receive favipiravir. Women under the age of 55 will require a negative urine pregnancy test at enrollment and will either need to have confirmed menopause or two current reliable methods of contraception prior to enrollment. In addition to this, patients who have previously been diagnosed with liver cirrhosis, have a known abnormality of uric acid metabolism other than gout, or have a known history of reaction to favipiravir or another antiviral medication, remdesivir, would be ineligible to participate. In addition to this, there are a few medications which would be contraindicated to be taken at the same time as favipiravir. These are pyrazinamide and hydralazine. Further, participants would need to be taking less than or equal to 3 grams of acetaminophen per day. Should an outbreak of COVID-19 occur in a participating long-term care home unit, we hope you would consider participating in our clinical trial to see if favipiravir may be effective in controlling outbreaks of COVID-19. We look forward to working together to find effective medications to control outbreaks of this new virus. If you have any questions or are interested in learning more about our trial, please take a look at our website as listed below. Or we're happy to hear from you by email at control.covid@sinaihealth.ca. Thanks for listening and talk soon.